Good afternoon. My name is Pat Bottenheimer, and I am retired. Formerly the Dean of the School of Health Sciences at Vancouver Community College. And for many years, I was a community health nurse and taught home support workers and have served on many different committees throughout British Columbia and on a national basis looking at these kinds of issues. And thank you to our panel. This has been a wonderful afternoon, and I've thoroughly enjoyed it. And so many of the comments support certainly my own personal feelings, but also just, it's nice to know that everybody's talking the same kind of talk. It makes it a lot easier. My focus today is on the education of home support workers. Just to be very clear, that's what I'm going to be speaking about, and I'm going to be telling you about a project that is just nearing completion that talks about education. And as I was thinking about it, and this hadn't occurred to me before, I don't know why, but I'm slow, it was perhaps this is the beginning, just a very, very small beginning of perhaps one solution for some of our national concerns. And this is a national project that I'm talking about. Just for your interest information, you may know this, but home support workers and residential care aides, those people that work in continuing care, are the second largest number of healthcare workers across the country, next only to nurses. And when you look at that in terms of the number of people we're talking about, that's a significant number of people that are involved in healthcare. And there are many issues, particularly in terms of, the whole work environment and their education in particular that impact the quality of education and the kind of education that they have had. I'll start by saying one of them is the name, and I'll be talking a little bit about that and further. There is not one single name that is this level of worker is called across the country. There's probably about 25 to 30 different names, so it's really hard to know who we're talking about. The quality of education, although it's much improved in the past years, has been hit or miss, to be perfectly honest, and the number of educational providers is growing considerably. Many students enter this program because it is an entry-level program, which is a good thing. I think my personal belief is that this program gives so many individuals an opportunity to have some success in their lives where they may not have had that kind of success before. The entrance requirements are fairly minimal, and I'll be going into that in a few minutes. But students often are very passionate about wanting to get into this kind of work and wanting to be successful, and once they have that success, it's amazing to see that and to see them bloom and blossom and often move on to other areas, move into practical nursing and even a baccalaureate nursing, which is always wonderful to see that progression. And for new Canadians, these type of programs also provide often an entry level again to some work in their new country where they may not be able to qualify as nurses or may have to wait a while until they do, so they can enter this kind of a work environment in order to feed their families, which is often the most important thing in their minds. So I do believe that education can make a huge difference to the lives of both the care providers and, of course, as we have talked about, the health and safety of the clients that they work with. And agree also with the comments that have been so eloquently made earlier in terms of the value of this worker. I really do feel they have been undervalued. I think they are critical to healthcare, and we as educators need to improve that just in their education so that they feel good about what they're doing and feel valued in what they are doing, because it is an absolutely necessary service. Okay. Just a little bit of a history here. In 2003, the Canadian Home Care Human Resources Study, which I was part of that steering committee, and actually Marcus Hollander was involved in that as well, made a recommendation that one of the recommendations focused on the preparedness and training of healthcare workers. So it was to develop strategies for educational preparation, formal continuing education, and employer-provided training to facilitate the availability of qualified home care providers. And I'll talk about some of the kinds of training that there is, because at that point, there wasn't always consistency in the education. A year later, the College of Pharmacists also produced a beginning report on the awareness of home support workers and made recommendations that home support workers need to be educated in terms of medication assistance and assisting clients with medications as well. In 2007, the Future of Home Care in Canada spoke to the need for improved education and professional development in the home care sector. In regards to human resources within the home and community care sector, training, accreditation, and compensation schemes need to be expanded and improved. Measures are also needed in the short term to counter increasingly dire labor shortages. And of course, the labor shortages vary from time to time. More recently, in 2009, the Canadian Nurses Association conducted a study and had a symposium called Maximizing Health Human Resources, Valuing Unregulated Health Workers. Now, home support workers, or whatever they're called in your jurisdiction, are unregulated. There is no licensure registry. Well, we have registries now, but there's no... There's inconsistency. Certainly, they're not regulated by any professional body, and so that, and that's the case not only with home support workers, but rehab assistants, medical lab techs, pharmacy technicians, and this kind of thing. So that is changing a bit. But the one of the priorities for the Canadian Nurses Association study was to develop educational programs based on established and identified competencies. So that meant curriculum development, standardized entry criteria, etc. So that tells you that for many years there have been recommendations for addressing education across the country, and not much, in fact. Very little has happened until just recently. So I'm here to tell you about a project that is just about completed. It is called Promoting Mobility in Education, National Educational Standards for Personal Care Providers. And personal care providers is the term that we've chosen to use because, as I said, there's about 25 different names used across the country for this level of worker. So when I say PCP or personal care providers, I'm talking about your care aides, your home support workers, your health care assistants, as they're called in British Columbia, continuing care assistants, as they're called in Nova Scotia. It varies across the country, as I've said. This project was a partnership between the Association of Canadian Community Colleges and the Canadian Association for Continuing Care Educators and Health Canada, who provided the funding. And I'll speak to the partners just briefly. ACCC is, as I said, the Association of Canadian Community Colleges. It is a national voluntary membership organization consisting of all the publicly funded colleges and institutes across Canada. So most of our BC colleges, all of them, I think, belong to ACCC, BCIT, and so on. Every province has membership in the association. It represents to the federal government and to industry the voice of post-secondary education across the country. And it supports member institutions as they address different challenges. And this is how they have supported the Canadian Association of Continuing Care Educators. And they have affinity groups or sector councils. And sector councils do not exist in healthcare. So we became involved in an affinity group. Now, I'll tell you a little bit about... I'm a bit too busy talking. Okay. The Canadian Association of Continuing Care Educators is an affinity group of ACCC. Okay? And it is... the membership is composed of educators from across the country who teach in continuing care, these care aid, continuing care, whatever you want to call them, personal care provider programs within the public college system. This began with an impetus of the 4 Western provinces, and in fact 4 colleges within the Western provinces, one from each province, who got together and decided that they needed to talk about education and some looking at each other's programs to see how they match up. Are goals the same, and also looking at mobility for workers, which has been another problem. Those 4 colleges got together and met on a regular basis for many years and developed some standards of their own. But one of the things we saw is that there was, as we talked about this, and there was interest from across the country in joining this group. So in February of 2004, we established a continuing care affinity group, and that was at a meeting in Ottawa. And it was attended by several individuals. I think there was 69 different institutions across the country were represented. I chaired that meeting and became the first chair of the Continuing Care CACCE affinity group, and served in that position for 6 years. I retired from that position 3 years ago. One of the things that happened, we met on an annual basis, and one of the things that happened was we began to see what the issues were in education and continuing care. The first one was there was no consistency across the country. Different provinces had different curriculum, different, whether public or private, there was no consistency within any province, even in the kinds of education that was provided. And so it made it very difficult to really judge if you didn't know a little bit about education, if you were an employer, to find out, well, what kind of education does this individual have? Because oftentimes, as a dean, I often saw workers come to me and say, I need credit for this, and all they'd come with is a piece of paper that had, I took so many hours of X course. I couldn't do anything about that. And that was sad, because a lot of people had education, but they couldn't get the credits for it or the recognition for it. So there were no standards. There was nothing in terms of what should be taught, who should be teaching it, the kinds of experiences that should be offered to students, the kinds of support systems they needed within their education to help make them successful. And so a lot of people were spending money and not really getting a good value for their education, in my estimation. And thirdly, there was no interjurisdictional recognition of education. So you could have somebody moving from Ontario to British Columbia and go to an employer and say, I have my PSW certificate, here it is. And an employer in BC wouldn't know what that meant. They wouldn't be able to, and oftentimes, not always, but often they would lose a position because the employers don't have a lot of time to look at credentials, etc. And unless they knew somebody like me or another educator that could say, well, this seems to match, those people would be without jobs. And again, such a waste of human resources. And certainly does nothing to increase one's feeling about the education they have received and the value that they have to offer, even if you have people that have had very good work references, etc. I'm really happy to say that since 2004, there has been a huge change. So, bringing us to our project. In 2009, Health Canada phoned, actually, and said, we have your proposal. And they'd had it for a little bit of time, waiting for the right moment. And they said, this is the time. We're ready to support your proposal. And it's a proposal that we had written quite a few years ago now. Well, it takes time anyway to help it move through, but in order to look at national educational standards for this level of worker. So with that, we needed the support of ACCC because an affinity group is not, we didn't have any legal standing, so ACCC became our partner in that committee. And the project started in December 2009 and is officially just about completed. We're in the process of now winding up, and then all the documents have to go for translation, etc., being that it's a national project, but you will be hearing more about that, I hope. Part of the project includes not only the publicly funded, but the privately funded colleges as well. We had tremendous support from the National Association of Career Colleges, and are very thankful for that. And I must say, though, that not all private colleges belong to that association, so that's a bit of a difficulty, but nothing we can do about that. The steering committee was formed and consists of 20 representatives from across the country. We had representation from BC, myself and Laurie McKenzie from our Ministry of Post-Secondary Education. Did serve on the committee, although she wasn't able to get to any of the meetings, but she certainly kept in touch with us. And we had a personal care PCP on the committee as well from BC, somebody that works at VGH. But there was ministry involvement. It was really important for us to have that Ministry of Health and Ministry of Advanced or Post-Secondary Education, depending on what it's called in every province, involvement in the project, as well as national organizations. Canadian Home Care, as the Canadian Home Care Association was there, Canadian Nurses Association was there, VON Canada was there, as well as educators from across the country, and employers, of course, were important. So we tried to have as many people involved as possible on this committee because we needed to get as many ideas as possible. I was one of the co-chairs of that project. The other co-chair is the current president of the Canadian Association of Continuing Care Educators. So the project deliverables. First of all, to do an environmental scan. We needed to find out what kind of things are being offered in the education across the country. So that was one of our deliverables. It's been completed. The National Conference, which was held in March 2011, and some of you, at least one of you that are here, attended that conference, and I think was a real eye-opener. We needed to have that a conference to get consensus for the project to occur. Both health and post-secondary education are provincial jurisdictions, not national. And so if you didn't have the buy-in of the ministries, for example, to support the work we're doing, there's no point in moving forward because you needed to have that. And so it was critical for us to have that kind of support. So that was held in March 2011. I'll speak to that a little bit in a few minutes. And then the development of the standards was completed by the end of this month. It will be completed by the end of this month. Validation of the recommendations actually was done in January and February to make sure that we had a lot of feedback on our recommendations, and then there will be a dissemination strategy. There were two phases of the environmental scan. One was phase one, which was basically just to get an overview to see what was out there and to start the process. It included an overview of curriculum, and we used at that point mostly websites to check out, see what's going on in education across the country. Then looking at names, program entrance requirements, program delivery and length, learning outcomes and competencies, the core competencies for these workers, and then prior learning opportunities. The outcomes. This is, I think, more interesting for you than probably what I've said so far. But data was collected from 74 institutions, 11 school board, and in some provinces, this education is delivered in a high school environment. 47 public institutions and 16 private institutions. And we really did our best to try and look at geography and the demographics so that that there was representation from every province and north, south, east, west as much as we could. The jurisdictions that had the greater number, for example, Ontario and BC, have larger number of educational institutions offering this program than, say, Northwest Territories. So again, we had 31 from Ontario, 16 public, 4 private, 13 from BC, 10 public, 3 private. And Northwest Territories and Newfoundland, Labrador, Newfoundland and Labrador had just 1, and Quebec there were 9 representations. So we tried to really get as much representation from across the country. Phase 2 built on gathering the information, further refining the information collected in Phase 1. And it was actually a recommendation from that March meeting that we moved forward with that. It's interesting to note that in this education now, there are 6 provinces that have provincial education, which is quite a significant change. Some of them have moved very quickly in the last few years. BC, I see as a leader, and Nova Scotia. So on either end of the province, the country, we have leadership. BC and Nova Scotia have done really well in terms of their education and a lot of other regulations or registries and that sort of thing around the education. And but Alberta, Saskatchewan, Ontario, Nova Scotia, Quebec, and BC, and Yukon actually uses BC curriculum, so we all have provincial curriculums. Yeah. Okay, the March 2011 conference actually provided consensus. We did come out of that with consensus and several recommendations, which because of time I won't go into, but there was a lot of recommendations which we actually implemented in terms of the study. And it involved things like we added a couple of additional people to our steering committee to get wider representation. We looked at, and of course some of them are fairly straightforward, like use what you've got. Well, that makes sense. We use the curriculum that we already know and as a basis for developing the standards. One of the issues that is emerging and will continue to be an issue is what do we do with this? Because the standards have been developed. They will be published soon. They will be disseminated widely across from all the stakeholders and from the people that provided us with feedback. And we had 440 different individuals providing us feedback on the work done. So it was, and from all different stakeholders within the sector, healthcare sector. So it was widely disseminated, and feedback was provided. And thanks to, there were several people in this room did provide that feedback. So thank you for that. Based on, we expect to disseminate, but the biggest thing is, the issue emerging is monitoring and oversight of how the standards are being followed. At this point, there is no way to ensure that these are, there's no mandate for this. This is going to be voluntary. The thing we have going for us is it's supported by ACCC, which is the public colleges, and they will support this. It's been supported by the ministries, both health and education, as far as we know, and the National Association of Career Colleges is supporting it as well. So with those numbers, and particularly if employers get on board and know that there is this resource, they would use that and to determine whether or not an education is meeting the standards that it needs to be. And the standards are not only in the outcomes and competency, but the kinds of instruction, the kinds of clinical experiences you have. Like you can't just drop off a student at a door and say, get your experience. There needs to be instructors there. They need to have certain qualifications. They need to provide certain experiences for students. So we're hoping that setting these standards will establish a higher level of education and therefore obviously improved care, but also will help those home support workers, continuing care assistants, health care assistants, whatever they're called in your jurisdiction, to feel better about the work they're doing, because it is the most valuable work. There is further information. That's my own personal email, because I'm not working. And there will be information available. No, I'm not working. on the ACCC website very shortly about this project and about the outcomes. So, but it will be widely disseminated. We're hoping that it will make a difference. And I say it may be a little start to part of a solution. So thank you very much.